Glucose monitoring with the meter. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available at all times during the school day, during school-sponsored extracurricular activities, or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is blood glucose monitoring. Participants will be able to understand why blood glucose is monitored, when blood glucose should be monitored, how to perform a blood glucose check, and the required equipment. Blood glucose monitoring is the cornerstone of diabetes care. The goal of blood glucose monitoring is to maintain a blood glucose within a target range. The immediate benefits of blood glucose monitoring include identification, treatment, and prevention of high and low blood glucose levels. The long-term benefit includes a decreased risk of long-term complications. The challenge are many. The variables can impact blood glucose, such as insulin, food, activity, stress, injury, and illness. The Diabetes Medical Management Plan, or DMMP, is covered in greater detail in the units on diabetes medical management plans. The DMMP is the document that will specify in detail the student's diabetes needs at school. Educational plans, such as 504 Plan, an Individualized Education Program, or the Individualized Healthcare Plan, will elaborate on who does what tasks and where these tasks take place. With respect to blood glucose monitoring, the school should expect to facilitate blood glucose monitoring by allowing self-managing students to check their own blood glucose anywhere and anytime with provider and or parent guardian approval. Also, performing the check and or providing direct assistance and supervision to those who need help. Act on the results of blood glucose checks in accordance with directives in the DMMP. Document results of blood glucose monitoring when assistance or supervision is provided. And communicate blood glucose results to parent guardian or school nurse to monitor for trends per the DMMP. Who or what determines if the student is capable of self-management and can check own glucose levels? A determination regarding individual capacity for self-management is jointly made by the student, his or her parent guardian, and his or her healthcare provider, all in collaboration with the school nurse. What are the advantages of checking blood glucose levels anytime and any place? The student can achieve improved blood glucose control to prevent long-term complications of high blood glucose and complications of acute low blood glucose levels. It is safer for students because less time is lost between recognizing symptoms, confirming low blood glucose, and obtaining treatment with fast-acting sugar source followed by a snack or meal. The student gains independence in diabetes management when the blood glucose meter is easily accessible and checks can be conducted as needed. The student experiences less stigma as blood glucose monitoring loses its mystery when handled as a regular occurrence. Students with diabetes who check their blood glucose levels in the classroom spend less time out of the class. Self-checking blood glucose levels helps students to learn and understand decision-making process in taking the appropriate response to a blood glucose reading result. Blood glucose monitoring with a meter continues to become more simple and more reliable. The meters have gotten considerably smaller, making it easy for students to carry them from one school setting to another. Additionally, reliability with a very small sample size has improved greatly. Whereas it formerly took a large drop of blood to get a valid blood glucose reading, now the strips actually wick in the blood. The computer technology within the meters allow individuals to track insulin doses and food intake along with blood glucose results. These data can be downloaded to home or clinic computers for further analysis. Yet with all this progress, monitoring still requires repeated pokes 5 to 6 times a day and sometimes more. The limitations of using meters include not knowing blood glucose between checks. Between samplings, students must rely on their body signals to tell them whether their blood glucose level is out of the target range. Many students use continuous glucose monitoring, or CGM, for their blood glucose monitoring. In the past few years, considerable progress has been made in the continuous monitoring of glucose levels. The steps on the screen explain the basics of how the continuous glucose monitoring, or CGM, technology works. A tiny glucose measuring device called a sensor is inserted just under the skin. The sensor measures glucose in the tissue fluids several times a minute and sends the information to a phone-sized device. The system automatically displays and records an average glucose value every 1 to 5 minutes and is worn for multiple days with duration depending on the manufacturer. The state of the continuous monitoring technology is such that fingerstick checks are still required at times for either calibration or treatment decisions. Glucose monitoring instruction will be outlined in the student's DMMP. Most CGMs have alarms that signal when glucose is out of range. While continuous glucose monitors are becoming more common, they are still not used for all students with diabetes. Some individuals use them daily, while others for a short period to give the healthcare providers a picture of what is happening with glucose levels between monitoring times, particularly after meals and at night while sleeping. A student who wears a continuous glucose monitor to school still needs to check blood glucose with a regular meter before treatment, unless specifically stated otherwise in the DMMP. Not all CGM are FDA approved for treatment decision. Use CGM in accordance with the student's DMMP. More specific procedures for continuous glucose monitoring will be covered in another separate unit on CGM. Basic steps to using glucose monitoring as a tool. Number 1, know the target range. Each student's target range should be clearly identified in the DMMP. Number 2, check at times specified in the DMMP. And number 3, take immediate action by administering treatment to get the student back within their target range. Blood glucose checking should occur according to the student's DMMP. Regularly scheduled checks occur before meals and snacks, before, during, and after physical activity, as well as before dismissal. There are times when a student needs to check blood glucose more often than usual, including the following: when low or high blood glucose is suspected, either because the student is symptomatic or the adult observes symptoms. during periods of stress or illness, prior to academic tests, and when there are changes made in the management program, such as a change in medication doses, meal plan, or physical activity, early or delayed release from school, and when the CGM alarms. The conditions for performing non-routine blood glucose checks should be specified in the DMMP. Generally, the student and/or parent guardian will determine if and when additional blood glucose checks are required based on specific symptoms or concerns. Teachers are encouraged to bring concerns about frequency of blood glucose checks to the attention of the school nurse, student, parent guardian, and/or healthcare providers as appropriate. The basic tool for drawing blood for a glucose check is the lancet, a very small, sharp needle in a plastic sleeve. There are many types of lancets and lancet devices. Many students will use a lancing device, a pen-shaped lancet holder that launches the needle with a spring and controls the depth of the puncture. Some lancing devices have several depth settings to allow for the difference between sensitive fingers and calloused fingers. Some come with 2 caps for the end that touches the finger to adjust the depth of the puncture. In addition, the pressure of the finger on the cap determines how deep the puncture will go. It should be deep enough to provide an adequate amount of blood, but not to be so deep as to cause bruising or pain. If possible, allow the student to remove the lancet to avoid accidental contact to an exposed sharp by school staff. Lancets should be disposed of after use in a sharps disposal container as per parent-guardian's agreement with school and local ordinances. Some students may use a multiple fingerstick device that has self-contained 6-lancet drum shown in the picture at the right. Never use one's student lancing device on anyone else. There are many reliable meters on the market. Each has a unique set of features and operating procedures. A number of features vary from meter to meter. Some of the features are convenience-based, while others can be critical to accuracy of results. Features may include the sample size needed, wait times, or alternate site testing capacity. Work with parent guardian or school nurse to become familiar with the operation of student's particular meter. Or, if not available, blood glucose meters have a 1-800 number on the back to call for questions about meters and to obtain technical support. Also, manufacturers' websites have videos, demos, and user guides that may be downloaded. To prepare for a finger stick, number 1, gather blood glucose monitoring supplies to include the lancet, test strip, and meter. Number 2, student washes hands and dries thoroughly. Number 3, if assisting or performing for the student, put on disposable gloves. Number 4, turn the meter on if necessary. Some meters turn on automatically when the strip is inserted. Number 5, check code number that appears on the meter with the code number found on the container of the test strips. Many meters today may not require this step. However, if used, accuracy depends on using the correct code. Correct meter code if codes do not match. Number 6, insert a strip into the meter. Number 7, hold the lancet device to the side of the finger and press the button to stick the finger. Use the side of the finger as the tip and pad of the finger have more sensitive nerve endings. Express an adequate drop of blood. If an alternate site is used, The school nurse and/or parent guardian will give further instructions on the appropriate sites. Note: in the case of suspected hypoglycemia, only the finger should be used for blood glucose sampling. Number 8. How blood is applied to the strip is a little different from meter to meter. Follow instructions included with the meter on how to apply the blood sample. This slide shows 3 different kinds of strips to illustrate some things to keep in mind. With the first type of meter and strip on the left, be sure to drop. Do not smear the blood on the strip. With all meters and strip, be sure to completely cover the test strip window. The picture on the right illustrates that some strips actually wick the blood onto the strip by capillary action upon contact with the drop of blood on the finger. Number 9. Weight. Blood glucose results will be displayed on the meter. Meter processing times vary. Most will take from 5 to 1 minute. Number 10. Dispose of the lancet as per parent-guardian agreement with school and local ordinances. Never recap. Test strips may be discarded in a regular trash can. Plan for disposal of materials that come into contact with blood. Blood glucose monitoring does not present a danger to other students or staff members when there is a plan for proper disposal of lancets and other materials that come in contact with blood. The school health team should agree on the plan, which should be consistent with standard precautions and local waste disposal laws. Disposal of sharps may be in a container kept at school or in the student's personal container, a heavy-duty plastic or metal container with a tight-fitted lid. Used blood glucose strips and other materials may be discarded in the regular trash. Check with the student's personal diabetes healthcare team about health and safety requirements in your area. Number 11. Record blood glucose results and take action as per the DMMP. Meters do not only display numbers. Some display low or high for out-of-range readings. Some of them also display specific error codes that may indicate problems like an insufficient blood sample or that the temperature is out of range. You will need the meter manual to respond to these error codes. You can get information about a specific meter and test strips from several different sources. A copy of the manufacturer's manual for the meter should be provided by the parent guardian and kept in the health office for troubleshooting. The user manual will include a toll-free number in case you have questions or problems. Also, most meter companies now have their manuals available for download on their websites. In responding to and communicating about a specific reading, there are several things to keep in mind. Reaction to blood glucose check results should always consider the student's target range as it has been specified in the DMMP. Not all children will have the same target range. Even for an individual child, the target range may be somewhat different at different times of the day. Take action for blood glucose levels that fall outside of the student's target range as per the DMMP. Avoid referring to the numbers as good or bad, both to the student and to others. The fact that the blood sugar is being checked is good, no matter what the results are. Refer to numbers as in target or out of target, or below target or above target. Recognize value may vary according to the time since eating, insulin, or physical activity.